Strides have been made in the fight against HIV/AIDS, but it still remains a major concern. A virtual AIDS conference will be held to highlight the latest science, policy and practice of the pandemic in recognition of the global emergency caused by the COVID-19 outbreak. To speak about this, we're joined by Professor Linda Gail Becker from Cape Town this morning. Prof, good morning, and thanks so much for your time. So doing things differently this year, I suppose your range of topics and your agenda will look a little bit different as well in light of COVID-19.
Well, it does, Yuveka. We're very pleased that, I guess the difference is now that it's virtual, it's at everybody's fingertips, but it also means we can program 24/7. So the program will be transmitted around the world in 3 time zones. And so unlike what would have happened if we'd gone to California, we would have only been on Californian time. We now can transmit round the clock. So that certainly will be different. And this year, of course, we will have an HIV science, we'll have an HIV and COVID. And on the last day, we have a COVID-19 free conference for anybody to attend from around the world. And that'll be the latest science coming out of the COVID-19 epidemic as well.
I suppose, yes, with all the focus being so much on COVID at the moment, all the experts have kind of been distracted. And just give us some idea then, Prof, of who will be part of this conference. Who are we going to be hearing from?
I think you're absolutely right that the HIV world, in its broader sense, has pivoted. Many of us are infectious diseases doctors, so it's been only natural that we've also had to take on the issues that come with COVID. But HIV science is still very real, very important. And in fact, some of the programming we'll see at the AIDS conference is around the sort of impact that COVID has had on HIV itself, which I think is really important. I think even in this country, we're concerned that there's some displacement of HIV because of the incredible focus that has had to be on COVID. And I think it's really important that we take notice of that and weigh the consequences of the indirect impacts of COVID as well. So there will be that kind of latest science. But of course, HIV goes on, and there's some really important, interesting work on cure coming out of Brazil, work on new prevention, long-acting methodologies, just new science that we really want people who care about HIV to engage in and come to up to date about. And of course, in keeping with the World Conference, people can still, without registration, join our World Cafe, the main sort of artistic policy activism side of the conference. So that is available to everybody, even if they haven't registered.
All right, fantastic. And I suppose, Prof, what would be a key here as well is just looking at how scientists and experts from different countries have come together for a common cause, and that is to find this vaccine, to find any way of treating and dealing with COVID-19. And I know that this has been done for decades when it comes to HIV/AIDS, but might have sort of petered out a little bit. So maybe this renews that sort of camaraderie in trying to just to not just focus on COVID-19, to put the same effort into things like HIV/AIDS.
Absolutely. And I think, it's been extraordinary to see how the foundations and the systems that have been built through HIV over 35, 40 years are now seamlessly kind of being pivoted to COVID. And I think there are some important lessons there about how it is about the basic health systems. It's about understanding how epidemics work. It's about understanding what infection control is, and indeed how we globally join together in solidarity over these kinds of crises to make a big difference. And of course, we did that magnificently in HIV, and I think the same is demanded of us now for this pandemic. Many lessons can be brought across, but I agree with you. I think it's really important that post-COVID, whatever that world might look like, we recognize that HIV is far from over, and particularly in this country, we still have a great deal of work to do, and so there is no let up here. We have to keep moving forward with enthusiasm, with innovation, and with a whole lot more energy.
Well, as our president said, find your silver lining to COVID-19. And here you have a conference that will reach many more people than you were able to in the past. Thanks very much there, Prof. Well,